I got to start my mornings off in the best way possible, carpooling with my best friend Tiffany. It was nice having someone to talk to every morning, whether it be about our internships and how they were going, the good things and the bad things, or something completely different. I interned at Holzer Clinic in Athens. Although I got the opportunity to explore many different areas of the clinic, such as the surgery center, MRI, and CT, I spent most of my time in the chiropractic department with Dr. Ramsey and Bonnie. Here, I mainly observed patients getting their backs or necks readjusted, or getting treated for tight or sore muscles with stretching and heat and stim. As you can see, the room is pretty small, so a lot of the time I observed from the hallway in order to stay out of Dr. Ramsey's way. On days where Dr. Ramsey was really busy, I sat in his office and stayed out of the way. Truthfully, I usually played games on my phone, but hey, he said I could. That's why he's so cool.
We're going to hook Josh up to heat and stim for low back pain. Just place in his electrodes, and then he will lay on moist heat for 15 minutes. And this is what visit for this, Josh? You know, fourth time he's done this. Okay, go ahead and lay down. Intensity, this is the power level that he has this TENS unit set on. This is the frequency. This is the megahertz, the power that it's penetrating.
My favorite part of my internship was definitely observing in the surgery center. I was mainly here on Thursdays, when Dr. Ramsey was off. I had to arrive at Holzer a little earlier on these days, but I would say it was worth it. The receptionist always greeted me with a smile, and let me into the locker room so I could get changed into these way cool scrubs. Okay, that might be a slight exaggeration. I learned quickly that if you don't get there early enough, you have to wear extra large pants because all the rest are taken already. It's safe to say I was rarely late. After I changed into my scrubs, I headed back to the waiting area where the nurses, surgical technicians, and anesthesiologists hang out. I then went with them and the patient to the operating room. I got to see several procedures, such as bone spur removals, tonsillectomies, and several ear tube placements. I learned many different things in the surgery center, even though I just watched from a distance. The nurses always kept me informed of what was going on, especially when I couldn't see the procedure without risking being in the way.
The patient has knee pain, so I had an MRI done. We'll bring up the T2 weighted image. T2 weighted image just refers to the way the magnetic waves hit the hydrogen atoms inside of the soft tissues, the bones. It knocks them all a certain way, then the computer is able to detect how those hydrogen molecules line back up again, and that's how we get our different images. In a T2 weighted image, the bright signal is fluid, the dark signal is things like tendons, ligaments, also bone. So the more fluid something has in it, or more water, which is where the hydrogen issue comes, and the more bright the signal is going to be. And a bone spur is calcification of a ligament. When it has long-standing inflammation, you start to get calcium deposit over time, and you end up with those spurs. You can see here a real nice little spur turned up. And again, the joint surface is pretty irregular there. It's not nice and smooth and round. It comes down, then back up. It's kind of wavy. That's, again, an indication of arthritic or degenerative change. And again, you see it here as well on the tibial plateau. So this patient has an arthritic knee. That's the issue. Sent the patient to ortho for scope to have a lot of that arthritic change, the degenerative change removed, cleaned up essentially. And last I heard, she was doing well with that.
I also spent some time down the hall in imaging with Holly in MRI. She explained all the different images that need to be taken for the doctor to detect problems and how the MRI machine works. I didn't get to watch many different MRIs as they were being done, but Holly let me see different ones such as the brain, knees, shoulders, elbows, and spines. Although I didn't really know exactly what I was looking at, it was still cool. A lot of times these patients are Dr. Ramsey's and are sent back to the chiropractic area after their MRI to get evaluated.
Yep.
Okay, this is Dr. Ramsey. He's my sponsor. He's a chiropractor, and he's going to demonstrate hamstring stretches on my leg.
Okay, so stretch the left. Go ahead and straighten that out for me. I'm going to straighten your leg all the way out. That'll get the hamstring tightened up. And then I'm just going to push up until I feel that resistance. And then I'm going to hold that for a 5 count. 1, 2, 3, 4, 5. Push your leg down against my hand here. 1, 2, 3, 4, 5. Relax it. And then it goes up a little bit further. Again, hold it for a 5 count. And then push against me. 1, 2, 3, 4, 5. And relax. Again, it goes up a little further. Push again, please. Relax. And once you get to about 90 degrees, that's as far as you really need to go. Some patients will go farther, but that's fine there. Of course, you want to stretch the other side just to keep everything even. Again, straighten the leg and up to feel that resistance. Push against me, please. And relax it. Push again, please. Relax. Again. Relax. One more. And relax. And that technique is called PNF stretching. And when you cause a muscle contraction with the stretch, you can get just a little bit more of a stretch out of it the next time. And that's the best way we found to stretch hamstrings.
Thanks.
Yep.
My internship at Holzer Clinic was a great experience overall. I got an idea of what a career in a medical field would be like, and what field in particular I might be interested in. This experience will definitely help me in my future career decisions.